Hello and welcome to this evening's Tiger webinar. I'm Lydia Palmer from RIT's Division of Development and Alumni Relations, and I'm your moderator for tonight's webinar. We are happy to have you join us, and we hope that you and our entire Tiger family are well and continue to weather this new working environment to the best of your ability. We want you to know that the RIT Office of Alumni Relations is available to help all RIT alumni with a variety of needs, including new virtual content, learning opportunities, and networking and career assistance as our workplaces and our world work through the pandemic realities. We especially encourage everyone to connect to the RIT Alumni Association social media channels, including Facebook, LinkedIn, and Twitter, where you will find up-to-date communications and opportunities to connect with other Tiger alumni in your region and your industry. Those links are found in the chat box, and the chat box can be opened by clicking on the chat tab at the right of your webinar window. Many in our RIT family have asked how they can help our students and the university as we respond to the pandemic, and we are incredibly grateful for those offers. There is an unprecedented need for financial aid scholarships for current and incoming Tiger students. If you are able, please make a gift at the link in the chat box, and we thank you very much. We want to ensure that everyone is ready and familiar with the presentation tools. If you are joining from a remote location and are currently signed into your company's VPN, we encourage you to close that channel during the webinar to increase the quality of the transmission. The webinar platform is secure and does not require VPN access. All attendees have joined in mute mode. However, our presenters are happy to take questions during this discussion. Your questions can be entered in the chat box, and we will turn to your comments and questions after the first part of the presentation. You are joining this event using broadcast audio. If you wish to dial in by phone, dial-in information is provided in the chat box. Live captioning is also being provided, and you can find the link to access that in the chat box as well. This webinar will be recorded and made available, complete with captions, in approximately 1 week following today's event. All participants will receive an email with the link to the recording. If you have any technical questions, please feel free to type those into the chat box as well, and we will do our best to get you the appropriate answers. Now on to our webinar. Tonight we are presenting the first in a series of discussions entitled Living and Leading Through Pandemic, a Critical Thinking Series. In this first session, Dr. Jennifer Schneider, RIT's Fram Chair in Critical Thinking, and Dr. John Hummel of the Argonne National Lab will discuss critical systems. Dr. Hummel is the lead for Integrated Resiliency Analyses in the Decision and Infrastructure Sciences Division at Argonne. He has over 30 years of experience in developing and using modeling and simulation applications in a variety of military domains, such as environmental representations, logistics, simulation architectures, and the impacts of climate change on national security. He led the development of efforts to create a framework for assessing societal and regional resiliency, and has also supported activities analyzing critical resilient infrastructures. Dr. Schneider, CIH, is the Eugene H. Fram Chair in Applied Critical Thinking at RIT. In addition to being the Fram Chair, Dr. Schneider is a professor and lead of the Collaboratory for Resiliency and Recovery at RIT, which specializes in the data to decision pipeline to support community resilience decision-making, particularly at the regional and local level. Corporate sustainability, process safety, including cyber, risk and exposure assessment are other areas of focus. Jen also grew up in a first responder family and is a retired volunteer hazmat responder and commander, and was a member of the New York Respond Commission for Hurricane Sandy. This series is sponsored by RIT's Office of Alumni Relations, the RIT Fram Chair in Critical Thinking, the Institute for Business, Government, and Society at RIT, and the Collaboratory for Resiliency and Recovery. Dr. Schneider, Dr. Hummel, we are so glad to have you with us this evening, and our audience is all yours.
Thank you very, very much, Lydia, for that great introduction. I'm impressed that you got through all the verbiage that we gave you. I think this is going to be a lot of fun, and I'd also like to thank my friend John Hummel for coming along on this ride when I had this idea. John was originally supposed to come to RIT in March to do a presentation and some meetings in person, but the pandemic preempted that. Again, thank you so much, John, and let's get started. Okay, so to really think about the issues of risk and criticality in our communities, we have to really think about how risk measurement started. And if you look at this cartoon here from Calvin and Hobbes, and I'm going to admit that Calvin and Hobbes is one of my very favorites, and I grew up reading the funny pages, as they call them. You'll note that they're talking really about measuring risk for when something breaks. And this really has been the baseline about how we manage risk for many generations. But over the years, we got a little bit better. So let's move this beyond a bit. We can think about risk as a continuum that starts out with realized risk in a crisis, through a recovery period. And John and I may not argue we're not in recovery at this moment quite yet with pandemic, and then into a resiliency where we will rebuild and re-recognize and reconstitute our societies. The ability for a community to move its processes from crisis to recovery to resilience really is indicative of the capacity the community has to manage it. So that capacity can be measured in a bunch of different ways, one of which is this. I don't really mean for this to be an eye chart. All I need you to see are the different colors that are there. If you look to this from left to right, you'll see colors from green to yellow to blue to red. These denote different types of disasters or risks to a community. The wider the line is, the better the community is at handling its different types of risk. In a perfect sense, a community would get all the way over to a 5 on the Likert scale. Now, these 33 cities that we have measured were part of the first set of communities that were helped through the Rockefeller 100 Resilient Cities Initiative. You can see even those first communities never quite got to systems that could manage any catastrophe. But where do we get those numbers from, and how do we measure this stuff? Well, that's another eye chart. This is just a portion of an eye chart from something that we built locally for Rochester, New York, as part of a partnership with the region. We looked at all of the contributors that created decision-making and resilience for the community, let's say in a snowstorm, something that Rochester knows well. In that process, we looked at each of the elements that have to work for the community to be resilient and whole. To give you an idea, this chart started out with 315 critical pieces of infrastructure that had to operate. And each of those broke down to typically another 25 subroutines in the system. This led to a tree for decision and capability that had over 28 branches. This is just one of those branches. It seems complex, certainly, but in many ways it's not. It's sort of like when you built those domino trees when you were a kid and you had to be very careful not to knock them over in the process. It simply is looking at this as each of those pieces as a domino that let the whole thing operate, or when you finally kicked them off and you watched them go across the floor. John?
Okay. I think we would all agree that the pandemic we are living through right now has totally changed how we think about emergency management. What I put together is, on the left is a summary of the disasters that hit the United States between 2010 and mid-2019. The total number of natural disasters that hit the United States caused approximately 5,200 deaths and approximately $761 billion in damage over the Northeast United States. And throughout the United States, a lot of critical infrastructure was damaged or destroyed. Now, let's look at what we have been experiencing since January. There have been over 1.5 million confirmed cases, and actually, since the time we wrote this, over 90,000 deaths, 30 million unemployed in all 50 states and territories. The critical infrastructures have been stressed, but they haven't been damaged. A vastly different kind of situation, which it really requires that we think about things in a totally different way. Next. Now, a question that we get asked all the time is, okay, what is the level of resilience in my community? And if, in thinking back to what Jen talked about, I think it's clear there's no one single simple answer in that, and in one aspect of it is that there are a large number of system components that have to work together. Now, something that we have been doing for FEMA in terms of looking at community resiliency is how can we come up with some assessments of a community's resilience to various COVID-19 issues. And we have developed a tool for FEMA. It is called the Grassroots Infrastructure Dependency Model, that it allows you to look at a variety of different transportation-related concepts and ask various kinds of what-if questions. So we are in the process of adapting this specifically for COVID-19 responses. And this is an example of one of the products that we are able to generate down to the census tract level. And what this example is showing are the travel times from Chicago to all of the known COVID testing sites around the city. The light blue area in the center is, I think it's 25 minutes time to get to a testing site, and then the darker blue is, I believe, 50 minutes. Okay, next.
So when John and I started to think about what are some of the longer term implications for these community critical systems related to the pandemic, several things became clear. Frankly, even though DHS and FEMA had considered pandemic as a primary risk for over a decade, we were still unprepared. The scope is huge. Typically, when we think about critical infrastructure, we think about critical infrastructure in terms of roads, bridges, civil infrastructure. We think about it in terms of food systems, power and electricity, water, communication systems and ICT and such. We even knew that hospitals were a linchpin in the process, of course. But we never really understood the level of implications that there would be with the pandemic. The scope is just absolutely huge. And beyond that, the science, as you know, if you read the news, and how could you avoid it, is that the science is absolutely difficult. The access to tests that are accurate, vaccines and treatment, while we're working on it, we're simply not there. And it's also, from an emergency management perspective, very difficult to implement our typical shared resource mutual aid type system. Most of our emergency planning assumed that another region would be able to share resources and materials in the time of crisis. In this case, instead, we really have got ourselves with almost a competitive model going on. And what's worse, there really isn't a place to escape. Finally, you can also think about this as proliferation of the risk. The risk in the system has also changed. The humans are now the hazard, not the hurricane, the flood, the tornado. And what's more, we can't really see them coming. We don't have a prediction system. there isn't a weatherman for pandemic. We don't quite have applicable engineering controls that we can be reasonably assured will work all of the time. So simply, we are left with behavior. We have to take care of each other and wearing PPE, protective equipment. Not so much to protect ourselves unless we've got N95 masks on or hazmat suits in hospital and treatment situations, but face coverings because we're trying to protect each other. So therefore, our choices are about protecting another person, not ourselves. Then from there, John, would you like to talk about Lifeline Infrastructure?
Yes, and I'd like to just add on to one point that you made about the science. Sure. One of the challenges that we're facing now is that the science is literally changing on a daily basis. You know, when you turn on the news, there always seem to be different kinds of symptoms that are showing up. So we're writing the rule book as everything is evolving. In terms of the Lifeline infrastructures, I think one of the things that we are seeing is that many of them are very intricately interconnected. And those interconnections are some of the ones that, especially when you look at the plans for states to open up again, they're forgetting that those interconnections can extend sometimes way beyond a given state's boundaries. So if it wants to open up, it has to be cognizant of the fact that it's going to have interconnections to other infrastructures and supply chains in other locations. So if state A is willing to open up itself, but it could be dependent upon situations and contributions coming from other locations, it's going to be a very difficult process. When you look at the healthcare system, there are a number of interdependencies in there that are extremely critical. The primary focus that we are seeing right now is primarily with the primary healthcare system, the hospitals, the emergency rooms, et cetera. But there are other aspects of the healthcare system in which there are very significant secondary effects that are occurring, and that are occurring because of the interdependencies, but because of the critical nature of the triage applications we're going through right now, they are very often being forgotten. Examples are in many of the social services, child welfare systems, domestic violence, substance abuse. Those have critical interdependencies that are being impacted. And like the issues that are facing the primary healthcare system, they also have finite resources in terms of the people that they need to staff them, and then the physical systems that they have to work with. So when their resources have reached a limit, that is the most that they can take on. Jen?
So I wanted to end our formal comments with some ideas around response strategies becoming extremely locally driven. This not only applies for the individual EMS or ambulance that may have to show up at your door to pick you up to take you to the hospital, but it also applies in terms of the demographics and the community systems for vulnerable people, as John alluded to, capacity within those medical systems, density of the community itself. And you can see that in some of the transmission rates in our major cities, in the politics that drive the policies that overarch the entire problem. Many times, local characteristics and flavors will impact our response for hurricanes, floods, tornadoes, whatever. But in this case, it's even more locally driven, sometimes even down to almost the household level, based on particular characteristics within a household. I think the other thing that is of major issue here is the extended nature of this pandemic. I can think of no other incident in my time in emergency management or in doing community resilience work that we've had anything that comes within a tenth of the time frame and scope capacity that this has. It just has gone on for a long time. Perhaps that's why it's even tough in our households to do the daily things that used to not be such a problem. I can tell you, even with my own teenagers who are currently been warned to be quiet while I'm on this webinar, we're all getting a little tired of each other, even in the simple things. But I also think there's another piece to this that may be a positive point, and that is that perception and participation is key. I talked a little bit at the beginning of the slide about the idea that we really have to take care of our fellow man with the PPE that we choose to use and the way that we interact in society until we've come up with effective vaccines and treatments, and that's very true. But this has also brought out the best in people in terms of taking care of each other in other ways, from sharing of resources or checking on neighbors and those types of things. Participation at all levels is what's going to get us through this. It isn't any different, honestly, except for scale, than what you might see after Hurricane Sandy, with neighbors helping neighbors. It's the same sort of idea. John, is there anything you'd like to add before I move on from this slide?
Yes, and that is, we have just started the hurricane season for 2020. And the first storm is already, I think, approaching the Outer Banks of the Carolinas. We're going to have a massive challenge if we have a series of hurricanes coming onshore. Because if you think about the situation we're in right now, the primary response mechanism that we are following is to isolate ourselves from our neighbors. If we get into a massive situation like a hurricane or tornadoes coming through, the response mechanisms are typically at the community level and to group people together. That could be catastrophic from the pandemic aspect.
Yes, John, you're right. Just because we have this particular type of disaster going on doesn't mean that we have stopped all others. We certainly could have many multimodal, as we call it, events that go on. So with that, I'm going to end with our final slide to be able to talk to all of you. Our contact emails are there, and I don't want to forget to invite you to the next in this series, which will be Ms. Suzanne Frew, who is an RIT alum, and Dr. Jess Pardee, a resident disaster sociologist, talking about social vulnerabilities in the age of COVID-19.
Great, and we do want to ask our audience, if you do have questions for Dr. Schneider or Dr. Hummel, go ahead and enter those right in the chat box. Can the two of you share any of your, we just had one pop up. I was going to say, can you share any of your direct experiences with the pandemic right now, recognizing that some of them may be things that you can't actually talk in full about, but I'm sure you've had some interesting experiences.
One thing that I can give you some detail on is some very recent work that we are doing related to critical hospitals. You might think of these as hospitals in rural locations or that serve specialized populations. Those hospitals, as I'm sure you've seen in the news, are under some incredible stress and strain. And we're trying to work on some predictive tools to be able to let hospitals know ahead of time whether COVID patients may show up at their doors. Now, can I predict that with all certainty? Absolutely not, because it has to do with our own individual patient response to that exposure. But if I can get a better idea of what an infection rate may be based on activity and behavior, I can give some predictions so that that hospital that has to do a lot of it on its own can actually survive.
I'm part of a multi-lab effort looking at various COVID-19 activities. And the group that I am working with is coming up with what we call situational awareness tools for decision makers. And one of the areas that we are looking at are workforce issues in individual counties. And we have data from the Bureau of Labor Statistics that has all of the industries in a given area, the number of workers, and we've used guidance from Department of Homeland Security to be able to do the identification of the workforces that are considered to be essential. Well, last week as an exercise to demonstrate the kind of capabilities that we'll be able to provide, I did the workforce assessment for DuPage County, which is where Argonne is located. And when we got the numbers, it was like well over 50% of the workforce in DuPage County is considered essential. And what that means is they are the workers who are still working, and especially those that have frontline responsibilities. They represent the workforces that are most vulnerable to infection with COVID virus. And one of the reasons we are doing that is that we want to be able to look at different recovery strategies to be able to say that as a given state or region goes from one recovery level to another, what are the workforces and the numbers of people that you are going to potentially put at further risk from infection.
Terrific. So we do have, let's start with the first question. Given the original infection models grossly overstated the morbidity rates, what is justifying our continued isolation policies? What other examples of isolating healthy population do we have to look at as examples?
So I can take part of that question. And at this moment, I'll freely say to you that this is Jen Schneider's opinion. It is my opinion that the biggest reason why you see us doing these isolation, stay-at-home type of policies is that we have chosen as a society to protect those that are vulnerable. It would be much simpler if everyone that had COVID-19 somehow had a sign on them that said, I have COVID-19, avoid me, so that those that had vulnerable conditions or lived with vulnerable people could get themselves out of harm's way. Unfortunately, that isn't the case. And so we do have to isolate lots of healthy, non-ill people so that we also isolate those that may be unknowing carriers of this virus so that we can protect those that are vulnerable. I don't think that we necessarily have a perfect answer. I would love to see there be some engineering control or treatment that was readily available. It's not quite there yet.
I agree with what Jen has said. There have been a lot of arguments made that, well, the younger folks have stronger resistance to it, so why don't we let them just go back to work? And yeah, the evidence seems to point to that they are less receptive to infection, but the concern is they can be carriers. And I think that is the one factor that is driving the shelter-in-place rules. Illinois has a very strong shelter-in-place requirement, and it's primarily because of what Jen talked about. We need to be able to protect the vulnerable populations, that when it does hit the people with either in certain age groups or people with underlying conditions, it is an extremely serious situation. So we have been seeing, the leaders acting with an abundance of caution.
Second, I think a statement as much as a question. Suggestions for leaders when the model is changing so quickly. What you decide today could change tomorrow. And I think that's an environment that we're very much not accustomed to.
Having been an incident commander and have been on multiple responses of various scales, although I freely admit I never expected anything of a pandemic scale. What I can tell you is that effective leaders essentially have three things at their disposal. One is an ability to be situationally aware and to understand what is going on to the best of their ability. Will they ever know everything? No. But should they try to know as much as possible? Yes. So that depends on the information, high quality information gathering that they have. The second is having some experience. And that doesn't necessarily mean that those leaders have been in a Hurricane Sandy or anything of that nature, but that they understand situations that can evolve and change and are comfortable in situations that evolve and change, that they're simply used to the idea of disruption. To that end, I will tell you that I find that some of my best incident commanders that I have ever worked with are folks that have spent their lives doing work in innovation or product creation, or have spent their lives, believe it or not, playing jazz music. Improv is real. Or has spent their lives doing work around scenario building and gaming. And in fact, I find that folks with that capacity also tend to do well. Beyond that is an ability to communicate, right? So communication goes two ways. It is not only to listen and listen well, but it's also to get a consistent message out there about what you know and don't know, and don't make it up. And we can find examples in today's society in various forms of people that have done well or reasonably well in time of pandemic, and those other leaders who have not. But those three constructs or capacities are really key to success for any leader in a time of stress, even something as large as pandemic.
I've spent most of my career supporting decision makers and policymakers. And the one thing that I've learned is that when they engage scientists, consultants, they don't want them to give them the answer, but they want you to give them the best information so they can make the informed decision. That's their job. They know all of the policy issues, the political issues, the economic issues, and they just need to be given the best information so hopefully they can make the best informed decision.
A different question. So when these decisions are being made, do they attempt to factor in the human behavior variabilities that seem to be driving so much of the situation we have today?
In the work that we're doing, we do include those factors. So we will give them our best assessments from the physical, environmental aspects, as well as the contributions that are coming from the socio-economic and political aspects. So yes, those factors are also very critical in the overall decision-making process.
As we are entering hurricane season and in recognition of the conflict in management strategies, what alternative planning is happening to manage hurricane disasters? Is someone working on this? And I think you can also add, we had a nice good morning earthquake on the West Coast at some point last week, I believe, right on the Nevada and California border. So it's not just the hurricanes on the East Coast, it's going to go across the country.
Well, in terms of the hurricane modeling, it's actually something that we do at Argonne. Argonne is a Department of Energy laboratory, so obviously we do a lot of modeling of energy systems. And there is a model that we use to predict potential damage areas if a hurricane is slated to come on shore. And There is very detailed planning that is taking things into account. In terms of, are they bringing in the COVID aspects at this point? I don't know, but I think I can fairly well guess that the responders on the ground will be taking that into consideration, because the humanitarian kind of assistance approaches are now also going to have to take into account the potential implications of the virus.
I actually have one small point to add to that. Some of our latest work at RIT was working with some hotel and hospitality associations to look at best practices during disasters and learn from those folks that are part of community response and recovery. It is not unusual for large hotel chains or even small ones to shelter in place folks during a hurricane, for example, or be the shelter for folks while they are rebuilding or allowing first responders in. And it occurred to the team that worked on this material over the last year or so, and we finished it last summer, that these are the same folks that we should be talking to when we're thinking about recovery from multimodal disasters in the age of hurricane and pandemic. Frankly, the hospitality and hotel folks are better than anyone at taking care of people. If we can just inject a little bit more pandemic science or other disaster know-how into that industry, which frankly has excess capacity at the moment, that might be a pressure reliever as we head into hurricane season, for example.
Next question. Are you aware of anyone studying the data from grocery distribution and sales data? The sequence of item depletions during the early stages of the pandemic seems like fertile ground for managing panic in the general public during future events.
That is a very, very good question and a very interesting one. The effort that I mentioned of the multinational lab COVID activity, that is one of the things that we are looking at. And, at the beginning of the, response activities, toilet paper was not what you could not find it. It turned out that it really wasn't a case of there being a shortage of toilet paper. It was just that the supply chain for the production of toilet paper was geared towards producing more toilet paper for commercial and educational venues as opposed to home use. And so then it just took all of the producers time to gear up to a different kind of supply chain approach. It was the same thing in food supply. There were stories in the news of dairy farmers dumping milk down the drain, of cattle, chicken, and pigs having to be slaughtered because there's no way to sell them. It was the supply chain that had the issues, not that the actual sources of the products were lacking. So yes, there's a great deal of effort looking at the sales, have a better understanding of how the supply chains work, so you can make faster adjustments in future situations.
John is absolutely right. And this goes back to our original emergency response planning, that we assumed that other regions would be able to supply mutual aid in the event of an emergency. So in his example, if toilet paper was the major thing that a region needed after an incident or a disaster, they could get some excess capacity or excess product from another region that didn't need it. What we didn't plan for was every region needing all of these critical materials at once. So it really does lend itself to some further investigation about what our best interventions may be. Is it interventions on creating better manufacturing capacity? Is it interventions on having critical capacity within our borders? Is it interventions on switching in the supply chain? Do we have to have a particular critical commodity in one form, or can we use it in another? These are all important questions for us to figure out moving forward. As I said, it was the sheer scope of the pandemic that even brought some of this delay.
Yeah, and thanks to Sandra Rothenberg, who shared that on Thursday, right? There is a global supply chain management webinar with the Saunders College of Business. So some of you in this discussion may find that interesting, and thank you for putting that link in there for the registration. There's still a question, apparently. Gary says that toilet paper was gone long before any business or schools closed. He's in Westchester County, and they still have a shortage. But they're saying that they think that the stores will have this in by the last week of May. So it also seems to be very regionally determined, and obviously Westchester, I think, sounds like it's getting some of the impact from the city.
I am not surprised. Every emergency, every disaster is a local experience, and supply chains are no different, right? So if the grocery stores or purveyors in Westchester County haven't caught up or can't get it from their regional suppliers, that's the kind of impact you see. It is interesting, though, because we do know that different regions in disasters will honor and want different things. In certain regions of the country, every time that there's a disaster, the first thing to fly off the shelves in Walmart is strawberry Pop-Tarts. In other regions of the country, it is Hershey syrup. I haven't yet to hear of a region of the country that is looking for lettuce or broccoli, but that gives you an idea. There are local variations and local wants and needs that will show up, and maybe Westchester also just really wants its toilet paper.
In your opinion, what countries are excelling in managing the pandemic and why?
Well, I'd say that's the $64,000 question. I would measure that in different ways. In terms of doing or having good measurement policies and procedures in place for tracking the disease. Oddly enough, most countries in Africa and many countries in the tropical regions around the world have the existing infrastructures in place because they've had historic issues with malaria and Ebola. So in terms of understanding the need to test, they're doing a better job. But they don't then have the necessary healthcare resources to really treat the cases if they do come up. In terms of countries that have been doing a better job in maintaining stay-at-home issues, India had a really countrywide, very rigidly enforced shelter-in-place system. Some European countries have. They have had much stronger shelter-in-place restrictions than in the United States. But then if you look at the strength of those situations to their curves of cases and deaths, you see disparities. And it's primarily because of their healthcare systems. So it is a very difficult question to answer. Some countries are saying they're doing a better job than others, but everything is going to depend on the quality of the data that they are generating.
Another question on supply chain was panicking and hoarding of certain products a factor in some of these shortages. What about educating the general public as to what may actually be needed for a particular event?
I think that there was a certain level of hoarding and panic because no one really understood how long this would take. And, we may not even know now exactly how long it will be until this will be over. And I put over kind of in some quotes because I'm not exactly sure that we'll know an endpoint and be able to declare anything over at any point. I think that whoever brought the question up is absolutely right, that there needs to be education about what your particular needs may be and the fact that more will be available. People hoard because they're afraid it will never be available again, and they want to make sure that they're covered. And we probably didn't do a good enough job to explain that even though the supply chains were stressed for certain household items, that we had the mechanisms to take care of that. In terms of supply chains for some of the critical items for those that are in our healthcare industry, those are very problematic. And I think it has taught us a lot of lessons about what it means to be prepared to make sure that those critical systems like our hospitals and healthcare can still run and protect the people that make them run.
I think when you look at, especially in Rochester, you know how to handle snow, and you know that if a storm is going to come, you need to be able to supply yourself for so many days. Same thing here in Chicago. And if you think of, like in California, everyone is supposed to have an earthquake supply case, for a few days or so. This was so totally different that no one had an idea of how long it would be before we would be able to buy things again. And I think we still don't know. And I think Jen was right. People just panicked. They just were so afraid that things wouldn't, come back, that they were stocking up on any paper products. It was sometimes quite surprising to go into a store and see the things that were gone. Obviously all the paper products, some of the cuter, especially food products were gone too. So this is just all uncharted territory.
Wondering if you can comment on some of the seeming irrational decision-making that goes on. And by that, we mean it's okay for there to be 700 people in a Lowe's, but you can't have 10 people at a party at home. Is that just a matter of the decision makers and our governments learning their way through this process and saying, gee, maybe that wasn't a great decision? Or is there really a reason that you think that that is a decision that should hold?
I think there's really two components there. One, it should be fairly level, whether you're in a Lowe's or you're at your neighborhood Main Street, get together, if you will. And I'm not sure that you should ever entertain having a neighborhood get together in times like these, but the same sort of ideas should hold. Part of the reason why sometimes there are differences across different scenes or different events is because in a Lowe's, for example, maybe people aren't as apt to run up to each other and hug each other and say hello, and maybe they would abide by social distancing requirements. We happen to have a family reunion that is currently planned for mid-July for my family, and it won't likely happen because I am not sure that I could refrain from hugging some of my family members, right? So some of it is about the kind of expected behavior that you would be apt to see in that location. Now, that certainly doesn't negate the fact that you have a couple hundred people in a Lowe's that is not safe any more than it would be safe if they were in the middle of Main Street. But sometimes behaviors are different in different contexts.
I think Jen captured it perfectly. In a social setting, people are going to be social. They just may forget about all of the social distancing requirements. And the few times when we've been out shopping, when we go into a store, we're gloved and masked, and we're there for a purpose, and we go in and get out. So we are far more cognizant of all of the social distancing requirements in those situations. In terms of coming up with what are the perfect mixes for things, I think that's still a part of the evolving science. That there was a study, I think it was in Science News last week, on what is the proper minimum number of people that you could allow in a group. 10 is sort of being taken as the rule of thumb right now. Well, there's some more detailed studies that have been done that were saying, well, some situations you might be able to get away with 25 or something like that. So I think people are just coming up with the best answers based on the best information they have at the time.
All right, we have a few minutes left. While our audience is considering what their last couple of questions are, I'm going to turn it back over to the two of you for any closing comments or thoughts that you have as we're continuing through this situation and preparing for the event on June 2nd, talking about the social vulnerabilities. Any closing thoughts?
Go ahead, John.
I think that the issue of the social vulnerabilities is a critical one. I don't know how much people have been following the situations here in the greater Chicago area. Chicago and Cook County has the dubious distinction of surpassing Queens County in New York City as having the most number of reported cases. And when they're doing the analysis of the data based on racial and ethnic and economic backgrounds, very strong social inequalities are showing up. And it is something that people are recognizing, but there really hasn't been a significant discussion about it. And I think it is something that will really have to be made at some point. So I am definitely looking forward to that topic.
I agree too, and that is probably where I would also put my final comments, is that ultimately this pandemic is a social disease. It is a social event. I can't look around out my window and see wires down or water in the street or even hear lots of wind. I have to worry about the gentleman that gets too close on my walk. Those types of things make it uniquely different, even for those of us that have spent our careers measuring community resilience and have been in emergency management. So I think we really have to spend some time thinking about what are the social constructs that are driving this disease, or I should say, this virus forward.
That's great. Thank you so much. I don't see any more questions in the comments section, but certainly if anyone does have additional questions now or after we've finished here, you can email them to ritalum@rit.edu, and we will direct your questions to our two presenters. All audience members, again, will receive an email from us in about a week with a link to today's webinar recording. And we do hope you will join us for the second in this event series, the Social Vulnerabilities and COVID-19, that will be offered on June 2nd at 6 p.m. Eastern Time. The registration is in the chat box and also on Dr. Schneider's last slide. Or you can see a full listing of our upcoming virtual events at rit.edu/alumni/tigers-staying-home. We have quite a number of virtual events coming up, and we'd like to include you in as many as possible. Thank you both for joining us today, and thank you to our audience for being here as well. And if our audience wants to exit the webinar, you simply close your browser window, and do let us know what you thought through a brief survey that you will receive via email after you have left. Thank you, everyone, and please have a wonderful week and stay healthy.
Thank you.
Thank you.